Well, about 40% of our case managers were social work trained, and all 3 of our team leaders were all social workers, and that was a strategic decision made by the bushfire manager at the time, Tam Tran, who decided that it was actually social workers that had the skills that were required at that time to meet the needs of the bushfire affected clients. And in saying that, that was certainly evidenced by the ability of social workers to address all of the different needs throughout time. So social workers had a theory base to work from, and were able to bring with them a set of ethics and values and beliefs that made delivering the service much easier for them. So in the beginning, what I mean by this is in the beginning we went from a very crisis-driven service, and that changed a little bit to a client-centred service, and then to a strengths-based service, and then at a later point advocacy and empowerment approach. And it was the social workers that were really able to make these changes really easily and adapt to their ever-evolving service, and that's what they brought with them.
Social workers were involved in both leadership and service provision in the disaster response as part of Centrelink and the broader human services portfolio response, which particularly sits around decisions by government about the payment of disaster assistance payments. On this occasion, and particularly as we move to Cyclone Yasi as well, acknowledging that we were also responding to the Victorian floods and the West Australian bushfires and floods, we needed to draw upon some other professional staff resources. So I basically coordinated, with the support of 2 very senior social workers, a professional services group that included some psychologists from within Centrelink and some allied health professionals from CRS Australia. The skills that we brought, I think, particularly from a social work perspective, the very first and most important one is knowing how to start where the client is and not assuming that you know what their problem is, and understanding that starting with the practical at that point when we were actually making contact with those clients was the most important thing that we could do. From the practical, you build the relationship. From the relationship, you build the ability to actually provide an appropriate intervention and referral to other support services. Other skills, I believe, were our ability to make a holistic assessment, looking at the individual in the context of their family and community. Our crisis intervention skills, absolutely critical in that time, and I think social work excels in that. They really understand how to undertake a crisis intervention response. Our knowledge of how groups, organisations and systems work and how communities work, absolutely critical to understanding how you shape the response and how important it is to network with other agencies and know your place in that response arrangement. And I think social workers are particularly skilled at doing that. I base that on having observed a range of professionals in that space, and I believe that's a particular skill that social work brings, as well as our ability on this occasion to support our staff at the front line, our customer service staff at the front line, and to advocate and negotiate on a range of issues.
Social workers were really central to the response, and that wasn't just because I'm a social worker. It was because the social workers had the skills that people on the ground were asking for. And in fact, the split was probably around 60-40 social work nursing. There were a few other people, other professions in there, such as some from psychology, 1 or 2 OTs, that sort of profession. But in fact, it was largely a social work response. And out of that response, probably 69-70% of the backgrounds of the people that we deployed were from acute hospital settings and from primary and community care. Right. Those sorts of people, particularly ED, emergency department staff, are very used to, obviously, disaster management. I mean, that's what they do in their daily work. They're always involved in managing very traumatic incidents for people who walked through the doors of the hospital. So they had very good skill sets. So did the acute and primary staff, because they're very used to outreach. So social workers as a whole are very good at outreach, because even within a hospital, of course, you don't just sit in your office, you get out and find who needs help from you. So the sorts of skill sets we looked at were very much ED, community, primary. A lot of social workers had disaster management experience. Many social workers had experience such as identification of deceased people in morgues, for instance, working with the police service. So social workers really had excellent skills in terms of what they brought to the need. And they were the skills that the team leaders on the ground were asking for in the affected areas.